Hello and welcome. This is a video about the BRCA gene. This is meant for clinical guidance and does not explain the microbiological or the laboratory understanding of this gene. As gynecologists, we cannot order this test for patients. If you suspect a woman is increased risk for breast cancer, then the patient should be referred to a breast surgeon. The risk assessment cannot be done by testing the BRCA gene only. The objectives of this video are to explain the meaning of BRCA gene, its significance, the meaning of BRCA negative or positive, how is this gene tested for and by, in which patient is the test done, who orders the test, and how reliable is this test. So BRCA is a tumor suppressor gene and is present normally in all human beings. When they are working normally, these genes can help to suppress breast, ovarian cancer cells from developing and growing. If the gene undergoes mutation, then they lose this power to control the malignant cells. So BRCA1 and BRCA2 are two separate genes in terms of their location, but their function is very similar. What is the relationship of BRCA with cancer? As we have said before, certain mutations in the BRCA genes makes cells more likely to divide and change rapidly, leading to cancer. And this only happens when the BRCA gene has undergone a mutation. In countries where systematically this test is done in patients with high risk of cancer, it is seen that about 1 in every 500 women in the United States has a mutation in either of a BRCA1 or BRCA2 gene. So what happens if you have a test done and you find out that you have a BRCA gene? If you have a fault or a mutation in one of the BRCA genes, your risk of developing breast cancer and ovarian cancer is greatly increased. Women with faulty BRCA gene, for example, have a 65 to 79% lifetime risk of breast cancer and a 36 to 53% risk of ovarian cancer before the age of 80. What is the meaning of positive BRCA? A positive test result indicates that a person has inherited a known harmful variant or a mutation of the BRCA1 or BRCA2, and this has put the person as an increased risk of developing certain cancers. What is the difference if you test positive or test negative? A positive result means you are carrying a gene mutation which increases your risk of cancer, and you can work with your doctor to manage that risk. A negative result may mean that you don't have the mutation or that you might have a gene mutation but doctors have not discovered yet. What is the test called? The test is called a BRCA gene test, and it is a blood test usually to check for the mutations. The test can help you to know your chances of getting breast cancer and ovarian cancer, but the test does not tell you if you have cancer. The test can use a sample of the blood, of the saliva, or from the mucosa of the inside of the cheek, and this sample can then be tested for the genes. So BRCA1 and BRCA2 are not tumor markers, but they only will tell you whether your risk for cancer has increased or not. So either parent can have a BRCA mutation in their bodies, and it can be inherited either from the father or from the mother. It's important to understand who should have the test done. The test is only recommended for those who have a strong family history of cancer of the breast or family history of ovarian cancer. Colon cancer also carries this risk. Many people with a very strong family history of cancer may not have BRCA positive genes tested. And not everyone who inherits a BRCA gene change will get cancer. What is the relation of BRCA in uterine cancer? Women with the BRCA1 mutation have an increased risk for a rare form of aggressive uterine cancer. If this is found, and if there is a strong family history, then a hysterectomy will remove this risk. If there is a strong family history of breast and ovarian cancer, then it does increase the susceptibility of a person for developing cancer. And this risk is present during the entire lifetime. So this risk may be as high as 24 to 86% for breast cancer and 16 to 67% for ovarian cancer. Women who have hereditary breast and ovarian cancer susceptibility may develop cancer at a very young age or even develop multiple cancers, and they share this risk with family members. In the end, I would like to repeat that as gynecologists, we should not order this test in patients. If we suspect a woman is at increased risk for breast cancer, then the patient should be referred to a breast surgeon. The risk assessment for breast or gynecological cancer is not done on the basis of detection of BRCA gene alone. Women with a past history or family history for cancer may have an increased risk for breast cancer because of mutation in non-BRCA breast cancer predisposing gene. So the risk assessment and testing for BRCA can only be done by oncologists, by breast surgeons, or by geneticists. With this, we come to the end of the video. If you like this video, then please press the like button, subscribe, share, comment, and press the notification bell for early notification of release of videos. Kindly subscribe to the channel to keep this channel alive and thriving.